does MedGlobal work every day to bring healthcare to a turbulent world? Because children suffer from malnutrition. Because no child should go to bed hungry, deteriorating from a problem we can prevent. Severe acute malnutrition weakens their bodies, stunts their growth, and steals their future. But with therapeutic nutrition, medical care, and support for families, malnutrition can be treated and lives can be saved. Because pregnant women need life-saving care. Because no mother should face childbirth in fear. With state-of-the-art portable ultrasound equipment, complications can be detected, lives can be protected, and families can welcome their babies with hope. Because chronic illnesses can be managed. Because diabetes, hypertension, and asthma don't disappear during war. Even when hospitals are bombed, families still need insulin, medicine, and care to live their daily lives with dignity. Because mental health in conflict zones is critical. Because trauma lingers long after the bombing stops. In Syria, Gaza, Ukraine, and Sudan, children and adults carry invisible wounds. Access to mental health care can restore resilience, hope, and healing. Because clean water prevents the spread of disease. Because safe water saves more lives than medicine ever could. In places where cholera and malnutrition are rising, clean water is the most basic form of health care. Because mobile medical clinics take health care to those who don't have access. Because in communities suffering from disasters and limited resources, healthcare must reach people where they are. A single mobile clinic can treat hundreds every day, improving access to sustainable, dignified healthcare through emergency response, health services delivery, and the building of resilient healthcare systems. Because training builds healthcare for tomorrow. Because when we train local doctors, nurses, and midwives, we leave behind knowledge that saves lives long after emergencies end. One training session today can mean thousands of lives saved tomorrow. Because new health facilities give patients a place to go. Because rebuilding hospitals, clinics, and maternity wards is not just about bricks and mortar. It's about giving people a safe place to turn when they need it most. Because healthcare is a human right. Because no one, no matter where they are born or what crisis they face, should be denied the right to care, to treatment, to life. Behind every number is a name. Behind every statistic is a story. Behind every patient is a life worth saving. That is why we are there.